There are four major root causes of most weight and health issues. All four have similar foundations. When someone tries to address their weight and disease issues without addressing these factors, success will be hard if not impossible. Number one, the first root cause of most health and weight issues is a lack of self-care. There are certain rituals in our society which are proven to destroy the part of our minds charged with the function of caring. These are called cremation of care rituals, and those ancient rituals are more a technology than anything else. Once the part of the mind that cares is inhibited by this ancient technology, a person is proven to care about very little, if anything at all, including themselves. Without care, this person will become self-abusive by design and will develop health and weight issues as a guarantee. Cremation of care rituals are based on exposing a person to a very traumatic incident, often in their youth, and in order to adapt to the fear-based event, the mind has to inhibit the portion of the psyche that cares and feels emotional pain. Once the function of caring is inhibited, the sensory perception equipment of the body can become numbed to the point where a person can't feel if they're hurting themselves or not, and literally can't feel if they're full, if they're hungry, if they've had too much to drink, if they need to go to the bathroom, if they feel sick from too much junk food, if their doctor is making them more ill with unnecessary surgeries and drugs, etc., etc. This means the person becomes disconnected from their nervous system, which exists to provide feedback about the world regarding what's safe and what's not. And without that feedback, the person in most cases will literally self-abuse themselves into an early grave because they can't feel what they're doing to themselves. Let's move on to number two. Many weight and health issues are also tied to how the mind has a very set psychological reaction to fear and trauma. This is very closely connected to the first point. Fear and trauma are proven to inhibit the function inside the mind associated with feeling and caring. All cremation of care rituals include large spikes in fear and trauma. When that part of the brain that stopped caring comes back on, the fear and trauma that the person wanted to avoid can be re-experienced. So the person can then easily become addicted to mind-numbing and sedating substances like narcotics, sugar, alcohol, caffeine, cigarettes, and medications. Traumatized people who have experienced great pain interacting with their reality don't want to touch that reality again, and therefore are magnetically attracted to any method of escape, sedation, and distraction. Unfortunately, the same forces that orchestrate the cremation of care rituals inside our society are the same forces that hand-deliver the sedative substances into our communities. The reason our handlers go to such great lengths to fine-tune this assembly line process, which pumps out millions of dysfunctional humans, is because of how dysfunctional people are easier to control and manipulate and rule over. Traumatized people and people in fear will self-medicate with destructive addictions as a guarantee, and this will produce a population of overweight and unhealthy people. This is the design. Our health and weight epidemic is not a chance happening. This is how the few rule the many. You can't rule over 7 billion healthy and empowered people, but you can rule over the same population if they're diseased, dysfunctional, depressed, disempowered, and dissatisfied. We're programmed from an early age to be sick and overweight, and then to demand more of what has never worked. It's that big a con job. The third root cause of our societal disease and weight issues has to do with a human's genetic need to feel in control, due to how control makes a human feel safe. There's a part of our mind that processes all our reality on our behalf, and then develops emotional reactions based on that data to help us cope with the full spectrum of our reality. That part of the mind is called the subconscious, and it easily concludes that our living conditions here in the developed world are more like slavery than anything else. Having no control of one's life is proven to be the most stressful situation a person can encounter. This is described as a lack of autonomy, and again, it tests as the most stressful situation a human can face: no control. When a person has no control, they'll be attracted to any situation where an illusion of control will be provided for them. So our handlers sort of wall off our society inside a circular prison where we become extremely depressed and dysfunctional because we're starved of control. Then one day, our social engineers make a small break in the prison wall and yell out to the prisoners, "Hey, you can have back an illusion of control. We're now going to allow you to control your junk food, your smoking, your toxic medications, your mutilating surgeries, your narcotic consumption, your pornography, your vaccines, your shopping for the junk we produce and fill your stores with, and the control of what job you work for us down here on the human farm. And you can control as much as that as you want every hour of the day." So of course the slaves, given a choice between no control and controlling this unlimited self-murderous rampage, choose the self-abusive control option every time, because it's better than no control at all. Many health and weight issues are attempts at control. The control of the destructive rituals our handlers hand-deliver to us, because humans can be manipulated into believing that controlling how they kill themselves is better than actually putting their efforts into dismantling the system of slavery that imprisons them. Also, when a slave has no control anywhere in their lives and only controls their alcohol, smoking, drugs, junk food, they'll become super defensive regarding giving up their self-abusive lifestyle because it's the only control they're permitted inside their fabricated and dysfunctional illusion. Again, this is a design and a method of governance, not an accident or chance happening. Many weight and health issues are the way a slave-based mind can best adapt to their life absent of control, when the slave master only permits them to control destroying themselves with various narcotic, abusive, and sedative substances. Slaves that are dysfunctional, depressed, diseased, dissatisfied, and disempowered will always remain slaves. So this is why this cycle exists. Number 4. The fourth root cause of health and weight issues in our society is mind control. All mind control is based on reward and punishment systems. For example, when a child is in school, they're rewarded for being on time and being quiet, and they're punished for being disruptive and late. All reward and punishment systems are forms of mind control and are designed to encourage a preset behavior and inversely designed to discourage the opposite behavior. So basically, the way mind control is designed, you program the mind to run after the positive emotion, knowing that it will be provided when the set behavior is executed, and inversely, you set the mind to run away from the negative emotion, knowing it will be provided instantly if you don't act to the social engineer's desires. Today, although there's no personal benefit to being sick and overweight, our social engineers do purposely make sure positive emotional rewards are handed out when someone is sick and overweight. This is, of course, an odd way to use mind control techniques, as they can be used for good, but there it is anyway, being used for evil. Today, if you're sick, you get perpetual boatloads of positive emotion. The easiest way today to get the attention of a parent or even a community is to be sick, or to openly declare that you have one of many diseases, and bingo, instant positive emotion, fundraising events, free food, and all the positive celebrity is piled onto the sick. And guess what our social engineers have woven into the fabric of our society regarding the treatment of healthy people who actually care about themselves and their children? Well, those healthy people are attacked, vilified, insulted, ostracized, mocked, and are never on the front page of the paper, receive no free money from the government or charity to support their healthy ways, and are figuratively placed in the corner of our society with their heads down. I could go on, but those are the big 4 root causes of weight and health issues. If someone you know is sick or overweight, remember these root issues that need to be addressed before long-term healing can be achieved, and those 4 root causes are: number 1, self-love issues need to be addressed. Number 2, past fear and trauma also need to be addressed. Number 3, control issues that live in negative behavior need to be addressed. And 4, mind control tactics that reward unhealthy behavior, disease, and even death also need to be recognized and dealt with in a rational manner. Stay healthy, and thank you for taking the time to watch this video.